Okay, let's talk about when you should get surgery. So we talk a lot, and I personally preach a lot about how so many of the orthopedic and especially arthroscopic joint surgeries that we do really aren't worth doing. There's a lot of evidence to show that even a sham surgery is more effective or as effective as the actual surgery. So just cutting somebody open, sewing them back shut for things like rotator cuff tears, and rotator cuff repair, meniscus surgeries, even things like ACL, and other kind of knee injuries, patellofemoral pain, and just cleaning things up, or exploratory surgery where we're going in there. The evidence just really doesn't support that, and actually shows that long-term harm is being done, that your likelihood of needing additional surgeries becomes multifold higher. So your likelihood of needing um, total joint replacements or other things becomes much, much higher if you have those surgeries done. Whereas most people actually fare pretty well if they just rehab those things. So when do you need to know, when is it a good time to have surgery? I think the best rule of thumb is the risk of not having this surgery greater than the risk of having this surgery because of surgical complications? And then again, once you have surgery in an area, your likelihood of needing additional surgeries becomes higher. And so that's when it's a life-threatening thing. So a lot of our heart surgeries or brain surgeries, cancer and tumor removal, and those types of things where the risk of not doing it becomes much higher than the risk of doing it, definitely have that surgery done. Those things are important. But a lot of our arthroscopic surgeries, especially, um, the evidence just doesn't, really support the fact that that's doing you less harm in the long run. And so I would say for those things, it's really be careful and think, is this limiting my mobility enough that the harm of not having it done is going to be greater than the harm of having it done? And with the understanding that it will limit your mobility for a time as you rehab it and things as you go through that, and that your risk of additional surgeries is higher. That being said, there are some times where you've tried conservative therapy, and that's a question you have to ask yourself. Have I really tried doing all that I could for a long enough period of time? We're not talking a month or two or three even. In many other countries, you have to do hard rehab for a year to 2 years before they'll approve some of these surgeries. Because most people, they find, within about 12 to 18 months of doing fairly rigorous physical therapy, have better outcomes than if they had the surgery done. And so I would say, have you really put it to the test? Have you really tried rehabbing and strengthening that area? If so, and you're still having complications, still having problems, then maybe that's a time to have that surgery done. And then things that are going to be debilitating, like severe irreversible arthritis in joints, like total shoulders and total knees, a total joint replacement like that, that makes a bit more sense, where getting that done is going to really free up your mobility and allow you to not lose mobility and function. Then yeah, I think that's an appropriate time to have that done. But you just have to be careful that it's not being led to you needing one of those types of surgeries by having a bunch of other little procedures done along the way. So it's definitely a judgment call. If you need help in weighing the pros and cons of that situation for you, feel free to give us a call. Let us know what you're thinking with that, and we'd be happy to help guide you through it.